Thank you, members, and thank you for your attention today. I've been in this House for 30 years. I came in and started working on getting people health coverage the day I walked in the door, and actually before the day I walked in the door, because I thought it was very important, particularly because people with mental illness could not get care. And the only answer to that was to make sure that they could get health coverage. But because of pre-existing conditions, they couldn't. And anyone who had cancer or anyone who had any other condition could not. And our high-risk pool in the state of Texas charged 2 times the cost of a traditional premium for anybody who had an uncovered condition. And it's very important to know that, because those folks would go to another job and then could not use the insurance they got to cover what they needed the insurance for. And so it wasn't a matter of people liked or didn't like people with mental illness or cancer. It was a matter that the rules were written and they were unfair. And I think that that's very important. But knowing that people look at government health care differently, or how we do that, the reality is there are different points of view. And so what this amendment does, and tragically, Texas has the unfortunate distinction of having both the highest number and the highest percentage of uninsured residents in the nation. Let me say that again. The highest number. And that includes those people under 138% of poverty that have mental illness and have cancer and have whatever there is out there that everybody else can go to the doctor and get help for because it's covered. Adding insult to injury, because of the economic turmoil and the mass job loss caused by COVID-19, an additional 659,000 Texans lost their employer-sponsored insurance between February and May of 2020. Let me say that again. It's very important to understand that 659,000 of the constituents in this House lost their health care. And believe me, COBRA costs a whole lot more. So they had no health care. And that's the reason why we have situations where we extend, and we tried to extend coverage to those individuals and weren't able to do so. But if we had this program in place, they would have walked straight into health coverage. Let me say it again, straight into health coverage. For the last decade, Texas has operated under a Medicaid waiver program that offset a portion of the cost that hospitals incur for providing uncompensated care. However, we need more comprehensive solution. I think we all understand that uninsured Texans are demographically and geographically diverse, making a one-size-fits-all solution unrealistic. This amendment will provide HHSC flexibility to meet Texans' health care needs by utilizing private market strategies like copays and tailored benefits. So in other words, what we have to do as members of the legislature, they would have to do. And give HHSC the authority, and give HHSC the authority to leverage increased provider rates. Let me say that again, increased provider rates. Members, this amendment would do 3 things. It would authorize and direct HHSC to seek an 1115 waiver from CMS to maximize available federal funds. So let me explain. Our 1115 transformation waiver is not the same as this. That money was to prepare Texas to move into expanded health coverage. It didn't happen. So because it didn't happen, those were waivers for states that had large populations that did not expand before the Affordable Care Act. And the federal government actually asked these states to apply for these dollars. So we did. As a matter of fact, Texas got the most generous, let me say that again, most generous 1115 transformation waiver out of any state. Any state. And this is a little dicta from me, after they said that President Obama's breath stank. That's a joke. But I want to say that because this is different from that waiver, which I said we need to actually do, which is the transformation waiver. We should get the Biden administration to put that back in place. So this would direct HHSC to utilize those federal funds to reduce the number of uninsured residents. Those are the federal funds that would be used in a demonstration waiver that would be non-Medicaid, that would cover the populations that other states have used specific programs that weren't Medicaid or used traditional Medicaid in a Medicaid expansion under the Affordable Care Act. It would direct HHSC to develop a delivery model that would promote personal responsibility, increase efficiency, and accessibility of services, and reduce healthcare costs to the state. Also, the control of this particular amendment would be in Governor Abbott, the Health and Human Services Commission, and they could present anything they wanted to present to the Centers on Medicare and Medicaid and Medicare Services. So that's important because it is not prescriptive to anything except the principles of Texas. That's it. So let me be clear, this amendment empowers HHSC and Governor Abbott to work with our federal partners to find a solution, a Texas solution to solve our uninsured crisis. So this amendment provides flexibility, incorporates conservative principles like personal responsibility and benefit flexibility, and most importantly, it will be revenue neutral. Because the state's cost to enact a waiver like the one envisioned by this amendment is offset by expected savings of uniquely Texas plan of $657 million and $704 million. If we take advantage of what I call the kicker, and that the federal government passed, we would get $3.9 million extra dollars for 2 years. This amendment, as I said, does not prescribe the manner in which to do so or force the state to expand traditional Medicaid coverage to these uninsured Texans. Many other states like Arkansas, Indiana, Missouri, Nebraska, Ohio, Oklahoma, and others have found unique ways to draw down significant federal funds to reduce the number of uninsured in their states. Certainly we can find a Texas-specific solution that would ensure as many Texans as possible to bring federal dollars back to Texas and bolster rural and urban economies, protect the financial viability of rural and urban health care and safety net systems, and put money in the state budget. Extending coverage to the uninsured will clearly demonstrate Texas's commitment to economic freedom and security. Access to coverage keeps hardworking people healthy and on the job. It supports entrepreneurs' efforts to start new businesses, and it protects Texans from serious financial challenges. Members, some of you know that in 2009, President Obama created a working group of state legislators for health reform, which was comprised of 32 state legislators from around the country. I'm proud to have been one of those 32 legislators, where we wrote and helped pass the Affordable Care Act. It was very important. Because I was there the day it was signed. And I commit to those principles that were in the original Affordable Care Act. So I would like us to expand traditional Medicaid in the way that the optional way that the ACA says you can do it. But we can't do that. And we know that. So I support and am in favor of that. But that is not what this amendment does. It does not expand traditional Medicaid to these populations. As a matter of fact, it becomes a demonstration project. What many of you don't know is that Arizona didn't have a Medicaid program for 20 years, but they had a look-alike to a Medicaid program. So, I understand and accept that some of you don't or can't support Medicaid expansion, but all this amendment does is to direct HHC and the governor to seek a waiver, a demonstration waiver, to bring our federal tax dollars home to help reduce the number of uninsured. And I think both Democrats and Republicans can support that fiscal responsibility goal. And just like John Zerwas asked this House to do something very similar, I ask for your support of this amendment. Thank you, members.